Hello, it's Dr. Rhonda Johnson. Today is Sunday, May 26, 2024, and May is Mental Health Awareness Month, and today I'm discussing anxiety in children and teens. Well, you know that mental health is an important part of kids' and teens' overall health and well-being because their mental health affects how they feel, how they think, how they act, and it also plays a role in how they handle stress, relate to others, and make healthy choices. Did you know that ADHD, anxiety problems, behavior problems, and depression are the most common mental health disorders diagnosed in kids and teens? Now, anxiety is a very general term that's used to describe a feeling of extreme worry or unease. You know, feeling anxious is natural after something upsetting occurs. But when a child or teen feels anxiety that lasts a long time or it prevents them from doing the things that they would normally do, then it becomes an anxiety disorder. Now, there are 7 different types of anxiety disorders, and I'm not going to go into them. The diagnosis depends on really what the child is struggling with. So, anxious teens, are different than anxious younger children. When they're younger, kids tend to worry more about things like being afraid of the dark or something bad happening to their parents or monsters or things like that. But teenagers are more likely to be worried about themselves. Teenagers tend to worry about their performance in school or in athletics or in social settings. Teens also worry about their social life and they worry about their changing bodies. So, what are the symptoms of anxiety in younger children? Again, these aren't complete and every child can manifest differently. But anxious children present with sleep disorders, so trouble sleeping, waking up, nightmares, things like that, complaining about stomach ache, headache, or other physical problems, avoiding certain situations like they're terrified about going to the doctors, being clinging around parents or caregivers. They may have trouble concentrating in a class. They may be very fidgety. They can have tantrums or crying spells, or even panic attacks, especially in teens. Now, teens can also have extreme self-consciousness or sensitivity to criticism. They can withdraw from social activity in addition to all the other things I've mentioned. They can avoid new or difficult situations. You can see their grades dropping off. They don't want to go to school. And in severe cases, substance abuse. So parents, what can be done? Well, first, anxiety needs to be recognized. The U.S. Preventive Health Services Task Force recommends that doctors screen kids from the ages 8 to 18 for anxiety because it's so common in U.S. children and teens. Now, the good news is that almost all types of childhood anxiety can be treated with something called cognitive behavioral therapy. This type of treatment helps kids change how they respond to different situations in a safe way. The Child Mind Institute, and I don't have any affiliation with this organization, but their website has a lot of wonderful resources for parents of younger kids and teens. And they mentioned that the goal is not to eliminate anxiety, but to help them manage it. Now, I encourage you to look at that website. I'll include the link. But in general, I want to just leave you with the recommendation that you always talk to your child's doctors or healthcare providers about your health concerns, any of them regarding your children, and also to know that anxiety is fairly common in children and teens, and most time they can be taught to manage their anxiety. I hope this is helpful. Take care, folks, and be well.